Place the HoverMatt on the bed before the patient lays down. The single patient use sheets can be kept under the patient. The surface of the single patient use HoverMatts are breathable so that moisture does not build up next to the skin and cause skin breakdown. This is handy for healthcare professionals because they do not need to position the HoverMatt underneath the patient each time they want to reposition. For patient comfort, a sheet can be placed on top of the HoverMatt. If the HoverMatt is not on the bed before the patient lays down, the patient can be log rolled onto the side while the HoverMatt is tucked underneath. The process is then repeated on the other side until the HoverMatt is centered underneath the patient. Before inflating, locate the straps and connect them loosely on top of the patient, allowing enough room for the HoverMatt to inflate. Also ensure that the patient's head is about 2 inches down from the top of the HoverMatt. There are 2 hose openings at the foot of the HoverMatt. Insert the hose into one of the openings at a slight angle and snap it in place. Make sure that the surface that the patient will be transferred to, like a gurney, is as close as possible to the patient's bed and lock the wheels. The transfer surface should be about 1 to 3 inches lower than the patient's bed. The person closest to the patient should explain that the HoverMatt will inflate and the air blower is noisy. Before the HoverMatt begins to inflate, the person closest to the patient should be holding onto the HoverMatt straps with both hands and their body should be close to the patient's. The person furthest from the patient turns on the air blower. The person closest to the patient gently pushes the patient at an angle to the receiving person. Without bending over, the receiver grabs the straps and gently pulls the patient into place onto the transfer surface. The person on the opposite side of the patient pushes the standby button on the air blower. Disconnect the straps. The HoverMatt can remain under the patient. Place the patient on the HoverMatt in the same way described earlier. There should be one person on either side of the patient. Connect the safety straps across the patient and attach the hose in the opening of one side of the HoverMatt. One person grabs the straps on one side and stays close to the patient while the other person turns on the HoverMatt air blower. The person who turned on the air blower returns to the opposite side of the patient and grabs the straps with both hands. When the HoverMatt is fully inflated, the healthcare professionals gently pull the patient up toward the head of the bed while keeping their backs straight. One person remains next to the patient while the other turns off the air blower. Disconnect the straps. The HoverMatt can remain under the patient.